The impact of rising healthcare costs on personal finance. The ever-increasing expenses of medical care have emerged as a major cause for worry since they have a dramatic impact on the personal budgets of people of all different demographics. This in-depth examination, which is backed by the most recent statistics and trends, investigates the many ways in which rising healthcare costs have an effect on people and families. Number 9. An overview of the increasing costs of healthcare. Specifically, what are the key factors that are contributing to the ongoing rise in the prices of healthcare? Rising healthcare expenditures have had an impact on the economy and on people for decades. The United States healthcare system will still be the most expensive in the world by 2023, costing close to $4.9 trillion annually. This comes to almost $14,570 per person based on the per capita computation, and it is expected that these numbers will rise due to a number of variables, including inflation, technological advancements, an aging population, and the prevalence of chronic illnesses. The main causes of cost rises include mental health issues and chronic illnesses account for the majority of healthcare expenditures in the U.S. The expenses of Medicare are rising at a startling pace as baby boomers approach retirement age. In spite of the fact that technical innovations like gene therapy and precision medicine may improve patient outcomes, they are quite expensive. Administrative tasks, which are disproportionately costly in the U.S. compared to other countries, account for a significant chunk of healthcare spending. These rising costs not only affect families, but also severely strain businesses and the government's finances. Number 8. The impact on household budgets is significant. This is now a significant line item in the budget of the typical American home, which includes the cost of medical treatment. Due to the fact that premiums, deductibles, and out-of-pocket payments are all on the rise, families sometimes find themselves in a position where they must choose between healthcare and other essentials, such as housing, education, or savings for retirement. Examples from the real world. After accounting for both premiums and out-of-pocket expenses, the average amount of money that a family of 4 with employer-sponsored health insurance spent on medical treatment in 2023 was $30,260. A household with a yearly income of less than $50,000 may spend up to 20% of their income on medical care, which leaves less money available for unexpected expenses or discretionary expenditures. These financial constraints make it more difficult to move up in the economic hierarchy, restrict savings, and worsen wealth disparities. Number 7. Medical debt and financial hardship. The buildup of medical debt is one of the most frequent causes of filial bankruptcy in the U.S. Despite the fact that the Affordable Care Act has decreased the number of uninsured individuals, many insured people face crippling expenses because of high deductibles and copays. The data analysis's main conclusions are as follows. As of 2019, an estimated 100 million Americans faced some form of medical debt. 41% of people say they put off or forgo treatment because of financial limitations, indicating a link between worse health outcomes and financial limitations. Within 6 months, those who have incurred large medical expenses have a 30% decline in their credit scores, according to study data. Implications for the long-run medical debt not only makes it harder to maintain short-term financial security, but it also limits access to housing, financing, and other opportunities that are beneficial for long-term wealth building. Number 6. The prices of prescription medications. The United States of America has some of the highest costs for prescription drugs in the world. There is still an issue despite the fact that certain recent legislative changes, such as Medicare's power to negotiate medication pricing, provide prospects for improvement. The statistics. Over the course of the last 10 years, the cost of pharmaceuticals has increased by 40%, which is much more than the overall rate of inflation. The cost of life-saving prescriptions like insulin has burdened some patients with out-of-pocket expenses exceeding $300 per month. One of the consequences, the high expense of pharmaceuticals forces a significant number of patients to limit their drugs, miss doses, or completely abandon therapy. This could potentially result in avoidable hospitalizations and even fatalities. Number 5. Insurance premiums and out-of-pocket expenses. There is a direct effect on both companies and workers brought about by the consistent increase in insurance prices. Despite the fact that businesses are being required to devote more money to employee perks, workers are seeing their pay remain the same as a consequence. As of late, trends. The average family premium for employer-sponsored insurance increased by 7% between the years 2022 and 2023, reaching a total of $25,500. Since the beginning of this decade, out-of-pocket expenses, which include deductibles, have climbed by more than 50%. The effects on employees. Because of the high initial expenses, employees who have health insurance with large deductibles sometimes put off receiving medical treatment. Particularly in fields that offer lower income, a significant number of workers have difficulty paying their share of the costs associated with healthcare. Number 4. This will have an effect on access to care. How does the growing cost of healthcare influence the ability of persons who are uninsured or underinsured to get medical treatment? An increase in the cost of healthcare has a disproportionate impact on populations who are underprivileged. In many cases, people who are uninsured, families with lower incomes, and ethnic minorities face obstacles while attempting to get access to medical treatment. Principal obstacles. A poll from 2022 found that about 30% of uninsured people delayed or skipped treatment due to the associated costs. Inequities in healthcare. The prevalence of chronic illnesses such as diabetes and hypertension is greater in communities of color because financially disadvantaged communities are more likely to confront these obstacles. Effects on the long term. When people put off or choose not to get critical medical attention, they often end up needing more rigorous and costly treatments in the future, which helps to perpetuate a cycle of inadequate health and financial difficulty. Number 3. Economic disparities and the healthcare burden. Inequalities in economic conditions are exacerbated by the expenses of healthcare, which disproportionately burden those with low incomes. It is possible for a single big medical disaster to bring about financial ruin for several members of a family. The case study comparing rural and urban communities. Costs of healthcare are often higher for those living in rural areas since there are fewer providers available and greater distances to go to get treatment. People who live in cities often have to cope with higher premiums and deductibles, despite the fact that they have greater access to amenities. There is a psychological cost. The ongoing stress of managing medical bills is a contributor to mental health concerns such as anxiety and depression, which further adds to the rising costs of healthcare. Number 2. Implications for public policy. Despite the fact that recent changes have resulted in modest gains, structural problems still exist. When it comes to policymaking, the issue lies in striking a balance between price, accessibility, and quality. Changes that are very promising. The Inflation Reduction Act introduced Medicare medication price negotiations in 2022 and set the maximum out-of-pocket insulin payment for Medicare recipients at $35 per month. Initiatives at the state level, like California's efforts to establish a single-payer system, are gaining traction. Those that need to be improved. It is possible that an extra 4 million uninsured Americans may be covered by expanding Medicaid in states that have not yet done so at this time. The reduction of total costs requires taking a number of important initiatives, including addressing administrative inefficiencies and increasing pricing transparency. Number 1. Methods for reducing the impact on one's own financial situation. In order to successfully control the growing expenses of healthcare, what actions should people take? There are many different approaches that individuals may take in order to lessen the financial burden of the prices of healthcare. Look into assistance programs. There are a lot of states and charitable organizations that provide assistance for families with low incomes to help them lower their medical bills. Encourage the adoption of better policies. It is possible that bigger changes may occur as a result of supporting local and national efforts aimed at healthcare reform. Enjoyed this video? Hit like, share it with others, and don't forget to subscribe to join our community.